Now I'll talk a little bit. This is one of my. I found this out in 1978. I did a lot of research on pyridoxine, vitamin B6. Go. The B complex vitamins are all in a chain that work our Krebs cycle that lets us get energy in our mitochondria. Okay, so B1, thiamine, B2, riboflavin, niacin. So if you do the biochemistry, look at the biochemistry of B6. It is responsible for hundreds and hundreds of enzymatic reactions that do many, many things. One of the things it does is to burn fat as fuel. So the body needs water and B6 and a whole bunch of other things to use fat as fuel. I mean, every pound of fat has 3,500 calories associated with it. Your brain would much rather run off of fat than carbohydrate, much rather. So would your heart. And so B6 is a pivotal nutrient for the interconversion of fat to energy, to fuel. Dieters are a group that will develop B6 deficiency. Alcoholics, classic B6 deficient. But there's other things too. They've done human studies, and this is where I came in '78. They were doing some human volunteer studies on B6 absorption, and some patients absorb 1/2 of 1% of an oral dose. So if you go 100 milligrams to that person, and you measure carefully, they absorb 0.5 milligrams. And so when you think about things like that, and other things that I have mentioned, oral contraceptives, I've seen women that have been on oral contraceptives for 20 years. They induce a tremendous B6 deficiency, as well as folic acid and other things. And so these women need to be super supplemented to get their cells. Remember, you have trillions of cells. And so all these years you've developed this intense B complex deficiency. You've got to address that. Other things, people with celiac disease, gluten intolerance can have malabsorption of B6 and thiamine and other B complex. So you've got to put these people on B complex vitamins, and specifically what I've had experience with was B6 injections for initiating this process of burning fat as fuel, along with everything else. Other things, other medications can cause malabsorption. The classic Premarin, Provera, the synthetic hormones that doctors use, clearly caused folic acid and B6 problems. Patients that are B6 deficient who have become depressed, and that's one of the signs of B6 deficiency, are put on Prozac or Paxil or Zoloft, and nothing happens. And what is happening there is if you don't have B6 in your brain cells, those drugs won't do anything. And so it's sort of like a stress test for your B complex status. If you have depression, you're put on these meds and nothing happens, think about putting the person on B complex. And I've done that, and what happens is it's like a miracle. It's like all of a sudden those medications are able to change those neurotransmitters and brain hormones so that you get the response that you want. Parenthetically, sometimes all you need is B complex and nutrition and hormones, and you don't really need the Prozac.